Hello, Dr. Craig Rundbaken here. I'm talking to you today from Phoenix, Arizona. Some call it Valley of the Sun. I tend to think of it as Valley of the Spore. The reason is we have a epidemic fungal disease here in Arizona called coccidiomycosis. Coccidiomycosis causes what laymen often call valley fever. It's caused by a fungus in the desert soil. Two species have been identified, Coccidiomycosis immitis as well as Coccidiomycosis possidacea. California species is more commonly immitis, and Arizona and elsewhere is more common possidacea. In the recent 20 years, valley fever case rates have soared. It's caused a significant amount of morbidity as well as occasional deaths to patients who become ill with valley fever. The fungal spore exists as a saprophyte on the desert soil. It lives off dead and decaying matter. It's on the surface to about 6 inches below. This is what the spore looks like under the microscope. When you have a group of spores and hyphae together, it's called a mycelium. And anything, again, that comes across the desert, like ATV, construction, can cause these spores to take flight. An animal or human that inhales a spore can then become infected with the fungus coccidiomycosis. The incubation period is thought to be 5 to 28 days. Symptoms will occur in about 40% of patients, including fever, chills, night sweats, chest pain, fatigue, muscle aches, joint pain, coughing, sometimes coughing blood. Sweats are profound, particularly at night, but at day as well. Here's a slide of a spherule. Once the spore has been inhaled and grows into a sphere, you can see how thousands of little endospores that grow within the sphere. And this particular sphere is rupturing and infecting adjacent lung tissue. I want to take a couple minutes and recap on the morphology and the life cycle of coccidiomycosis. Again, it exists as a mycelium on the desert floor to up to 6 inches below. There's alternating live, barrel-shaped spores with a connecting cartilaginous type tissue on the hyphae. Once it is brought up off the desert floor, whether it's a windstorm or doing an activity such as running or ATV, golfing, baseball, whatever it may be, these could disarticulate and then they can be inhaled by a human or an animal. And that's called the parasitic cycle. The spore then begins to grow from 3 to 5 microns to about 75 microns into a sphere. The sphere has internal septations, and literally thousands of spores are within the sphere, and the sphere can then rupture as it enlarges, and the spores then infect adjacent tissue, and the cycle then repeats itself. Once those spores can leave the lung, it's called disseminated coccidiomycosis or extrapulmonary disease. And again, it can infect the brain, the bone, the skin. Virtually every organ of the body has been found to have coccidiomycosis.